Hello, welcome to Planetary Health Annual Meeting 2022. And it's a pleasure to be here. I'm Vanessa Góes, and we are in the education section. We'll be presenting the site section entitled Planetary Health Education, the Effective Way to Inform and Grow the Movement. This was organized by a Planetary Health Campus Ambassador from Planetary Health Alliance. It was coordinated by Salia Sheriff. Unfortunately, he was not able to be here because he have visa issues. So me and Assad, we came to cheer this up. And so we will be talking about education, the importance of education, and about this important program that intends to spread the word about planetary health all over the world. It's an international program that have the intention to gather students from all levels, from graduate to postgraduate, to share this word in their communities, in their universities, through educational events, from events like initiatives in the community, research, and so I'll be glad to be introducing you. He's going to be talking online. So it's Salia Sheriff. He's from Liberia University. And he'll be talking about this important program and our actions to spread planetary health around the world. Thank you.
Yes, am I clear enough?
Oh, yes, sir. I can
Oh,
hear
thank you
you.
so much, Vanessa. Thanks, everyone. So glad to see you guys there at the PHA. It's a great pleasure for all of you, even us here online. We are so happy to be there. And I need some assistance to share my screen in just a few minutes so that I can do that. Thank you, Vanessa. Thank you, Assad, and the listening audience. Like you have already introduced us, we will have been more than happy to be there today. Better still, we are happy. We are a group of Planetary Health Campus ambassadors, and we are looking at the side events today titled Planetary Health Education, the effective way to grow and inform the movement. We mean the movement Planetary Health is a short presentation. It will be me, Assad, and that of Vanessa, as she already said. Planetary Health Education overview, especially from the perspective of the Campo ambassadors. In 2019, the Campo Ambassador Program was started by the PHA, and from there, it has recruited over 150 Campo ambassadors in 36 countries, and more than 15 planetary health clubs have been formed. And this has also been an enlightening process. The campus ambassadors, when they are trained, it becomes like a trainer of trainers, and they have been able to enlighten many other peoples on their campuses on what planetary health education is all about. Countries that have benefited mostly are the ones dotted. You can see from South America, Africa, America, and Asia, and other places there. We have done that. And the trends of participation of the Campo Ambassador program have actually been going, as you see there from the far left. From the left, you see from 2019 to current day 2022, the US has had the largest amount of ambassadors, followed by Nigeria in Africa, and then the Brazil in the Southern America, and then coming to Kenya per country. If you look at the trend analysis that we did from the right-hand side, you see that just by the US had the highest amount of Campo ambassadors so far, but Africa has been growing. In terms of intake per year, you see that Africa is actually been climbing on the ladder from 2019 till present. So at the moment, the largest recruitment have been coming from Africa in terms of ratio and proportion, followed by the US as well, and then the Southern America countries. While there's been so many sources of the Capo Ambassador Program, one, it has been a capacity building for next generation leadership, which we shall be talking about later today. And it has also been a very good educational platform for many of the ambassadors to be able to navigate their ways through digital platforms, digital education, and how to disseminate information, most especially on planetary health in remote places where they do not have access to do physical participation. And it also has been a very good collaboration. We have been able to collaborate with the African Hub, the East African Hub, and there have been so many hubs. The ambassador program has been able to bring us together. An example is the current presentation we are doing. Vanessa is from the Southern America, I'm from Africa, and Assad is from Europe. These are the kinds of collaborations we have admired so much with the planetary health education. And with that, we believe it is actually growing the movement of planetary health education. And it has also increased the membership of the planetary health in various universities, because the 36 universities currently, which are member, are as a result of the 150 campus ambassadors so far being trained. And many of those things has also been at a very good background when it comes to next generation, where young people have been encouraged to join planetary health movement. We have had several challenges despite those successes. Some of the challenges are establishing the planetary health campus programs. Many of us have had challenges, especially when it comes to institutionalizing planetary health as a curriculum in many of those schools, because these universities are established with their own core program or their base programs. So there's also a conflict of interest when it comes to leadership, where leadership of those universities sometimes feel that the program is are not part of their core values. Again, COVID-19 has been a challenge for many of us, issue of logistics as well. Despite we have been trying on the digital platform, but technology, finances, and projects has actually been a problem for us. So what are the way forwards? We have seen that planetary health education is a very good way, especially through the Campus Ambassador program, but we recommend that in every country or region, there should be an association of the various campuses from the clubs coming up with our national programs. Like each country has, we know from climate change perspective, each country has got its own climate challenges. So with these campus ambassadors coming together from the same country, forming an association or a society would be a very good way to grow the movement as well, because they will be able to address national issues in that way as compared to a community base in campuses. And shows also when such national movements are formed, we also feel that it will be a very good thing if you form a regional incubation center where people can have, like Africa, where there can be some high level of training in addition to the series of online lectures we have had. But if you have a center where lecturers can come and people meet from around the countries to go and learn about planetary health and see how best it can be rolled out into the very university. And it can also be a center where next generation leaders will be molded, their mind will be trained, and they will understand the trajectory of planetary health. And lastly, we also feel that the PHCA program, which is Planetary Health Education Program and Awareness Project, should be broad. We should think of seeing how best some of those community projects can be carried out that will increase sensitization, awareness, and even combining the community-based programs to that of the university-based program, that is the campus ambassadors. That will also be a very good thing to take a national action. On that note, I think that's the end of my short presentation. I would like to say thank you again for the time given me, and I would like to stop here and turn it over to Assad, who will continue from there. I'm so grateful and thanks to be there. Thank you.
Thank you. Thank you, Salia. So Salia
Yes.
just gave us an overview about this program and our challenges and how we should keep going forward. Communication and education are a key point to spread this word. So making network through universities and institutions all over, communicating this field is very important. So now we have Muhammad Assadsman. He's going to talk about the planetary health education in the medical field, talking about opportunities and gaps and future directions. Muhammad is from the University of Oslo. He's planetary health researcher and PhD research fellow at the Faculty of Medicine in the University of Oslo. As a medical doctor, with a master and PhD in public health and biosecurity. His interests in research are focused on the environmental dimension of antimicrobial resistance, planetary health education, and minority health. So please, Mohammed.
Thank you, Vanessa, for a nice introduction, and thank you everyone who are present in online and offline. So I will talk about the planetary health education in the healthcare professionals, like not including the doctors, nurse, or everyone who is in the healthcare education, healthcare faculty or healthcare field. So I want to focus on this particular field because planetary health, as the name implies, it relates to health to a great extent, and the healthcare professionals are one of the 6 pillars for contributing or achieving the goals of planetary health. It is somewhat different from previous dimensions or previous capacities of these similar topics like geo-health, eco-health, or other field. So the changes in our environment severely affect our health and jeopardize the decades of public health gains what we have gained so far. And if you consider the health issues, but it is very a small number of issues which are affected by the planet or the environmental change. So cardiovascular disease, respiratory disease, antimicrobial resistance, mental health, heat stroke, everything, forced displacement, these things. And then I have just shared one thing about that what can be done by the air pollution, and there is not a single organ that left from the detrimental effect of air pollution, and this is very harmful, and this is very alarming for us. And unfortunately, the topic I work, the antimicrobial resistance, that is not included in this particular article published 2019, but through my work and experience, I know that this needs an ecological approach to prevent this global pandemic of antimicrobial resistance, which I talked about long ago, like 2018. And the mental health, it has already given the proven discipline or proven history of the benefit from the climate change or the planetary well-being. And the pragmatic use of planetary health and nature-based solution is the key to mitigate the next pandemic threat. And in this case, as we mentioned, that it has a sharp focus on human health, and then we need to include everything through our anthropological activities in the natural system. And what is the transition system happens by foster collaboration to convene the empower the next generation and educate and dissemination. So all these 3 aspects I considered, or I realized that these are all related to the planetary health education. For education, we need collaboration. For education, we need to empower the next generation, the students, the early care researcher, all researchers, and to educate and disseminate these things. And this is one article which we published very recently, the planetary health education and capacity building for healthcare professionals in the global context. And what we found, this is the way we screen the publication or the discussion of the planetary health education, like PubMed, Web of Science, and Scopus. And then we found 33 articles finally to include in our, which have discussed the planetary health education about the in globally. And then we found that, and including all, including this, and you find that most of the discussion are focused on the medical student or nurses, and very few about the food and nutrition expert or the community health worker, physiotherapist, and not in the other disciplines. There are lots of disciplines in the healthcare professionals, so we need to be on board to make the success of the planetary health education. And most interestingly, the discussion of the planetary education or the necessity of the education is emerged from 2017 to some extent. And it's very new and it's ongoing. It's a growing field, and everyone should be on board. And the other thing is the available opportunity what we found. This is somewhat from the Planetary Health Alliance, what they are doing, the tremendous job they are doing. So from these things, I understood that the clinicians for planetary health, that is a very good opportunity for healthcare professionals. And all these things, for the nurses, the We Act Please framework, what we found in the review and the all the literature review. And the key resource, there is a AMI consensus statement for the sustainable healthcare education, Planetary Health online community, network of education for sustainable healthcare. The most important thing, the Planetary Health education framework by Planetary Alliance, which should be followed by the most of the Planetary Health education institutes who want to increase this education in their groups. And in addition to the literature review, we also searched for the different grey literature and the online resource for the available courses, and both short courses and long courses for healthcare professionals globally. And in that context, this is the short courses we found, and this is the long courses we found. And then what we found that the geographic distribution or global distribution of these courses, you see this distribution, there is a large area of the globe that is, there is no short courses or long courses for the healthcare professionals, no healthcare professionals. And this is somewhat, we found the gaps and the major gaps. So one gaps is the main gaps in the inclusion. So inclusion means we have very fewer groups of healthcare professionals engaged in this work. Medical, as you see that the medical students or nurses, there are very few other people like clinical psychology, the healthcare worker, which is the fundamental or basic framework in the rural area or the global south, and also for the physiotherapist and the food nutrition, everyone. There is not so many people are included in this discussion. And if you see that the integration of planetary integration is many clinical setting, for example, the specialty, cardiology, for example, cardiology, anesthesiology, endocrinology, this higher specialty in the clinical settings, it is very challenging to include this planetary health education system for them. This is because it is a highly specified education system. And then we also found that there is some political lack of political commitment or the educational bureaucracy in both global south and global north. And there is some, there is very lack of internal integration and cohesion, external cohesion. For example, in healthcare, medical, especially for the medical curriculum, it is very tough to change, even in undergraduate level. For example, in global south, especially in the Indian continent, South Asia, they follow the British curriculum. So in the undergraduate level, they are doing this for decades or like for 100 years. And if you want to change this, that needs lots of bureaucratic work, from the political commitment up to the institutional bureaucracy, these things. And this is a big barrier for doing this. And the other inequality, for example, the colonial distribution of initiative and thought, the unfair resource allocation, and the variable perception and awareness among healthcare professionals. We found in our review, we found that many clinicians, they actually hesitate to talk about planetary health or impact of climate change or the good effect of climate, the planetary well-being to their patient, because they think that the patient will not come to visit them later, or they are not interested to hear these things. So this needs to be changed, and poor policy and governance in global south, inadequate public engagement with clinicians regarding planetary well-being, what I mentioned. And this is the thing that apart from different success stories, because why we are here, we have lots of success stories, and the Planetary Health Alliance is working, like the Rockefeller Foundation Lancet statement is published in 2015, but in this, I would say that in the last 7 years, it has a tremendous advancement of this field, and that's why many people are engaged in this movement, because planetary health not only it's not only a scientific field, it's as well as is a social movement. They have established that. But even though there is a noticeable lack of knowledge and resource equity between the global south and north, the majority of the available courses and discussion of curriculum development presented in our article have emerged from high-income countries. That need to be changed. And there are more people from global south. They need to be on board. They need to be in the movement, and they need to be in the resource allocation, their awareness, everything. They need to be on the pace. And the similar previous concepts, such as One Health, have been developed with an integrated focus on animal health while neglecting the public health and environmental perspective, like other things. And the future direction we recommend, the first and foremost thing I understood, that is decolonization. So it is very important. So focus on faculty development, public and professional awareness, detailed network building of motivated healthcare leaders, for example, and regional hubs. They need to be on board for these things, and they aligned with the political agenda. And the involvement of the students and trainees in developing and implementing curriculum from the very beginning. Usually it comes from up to bottom, but it should be the bottom to up approach. So usually the curriculum, it is imposed on the students from the top. They don't participate in the discussion from the beginning. There is no piloting of these things. I can share my experience, or maybe it is the same experience for all of the students from 2000, that time. In the community, there is a community medicine subject in 4th year or 3rd year and 4th year. And that the teachers, they consider it is like a Bible of the books or the Quran, that everything you should have been the same definition what is written in the book. And it was a burden for the kids or the students that to just memorize everything, not to understand the real theme. And then when I built my career in public health, then I realized that it is more important to realize the movement, realize the magnitude of the problem, not it is beyond the definition. So these things need to be changed, and the civil society, politicians and professional bodies like in different, especially for the Global South, the Medical or Dental Association, the Association for different professional bodies, they are very powerful and they need to be engaged, and they can affect a lot. And the implementation of patient-oriented planetary health management, that it was very much needed, and that's why initially, instead of focusing on the specialty, our group, or we focus on the basic course for all general practitioners for the same, like in the global module for the all general practitioners around the globe, and the universal planetary health module for all healthcare professionals. It is, unfortunately, it is absent in the discussion that there are lots of curriculum discussion, there are lots of documents are being produced, but there should be some universal planetary health module for the all healthcare professionals, or as a whole for all the people who will work on planetary health. That should be in place. And thank you. Thank you all. If you have any question here who are present and the Zoom meeting, we are here to answer or respond these questions now. Thank you.
Thank you, Assad. Amazing presentation. I forgot to introduce myself. Actually, I'm an integrative health professional, a registered dietitian, wellness mentor, and Pilates teacher. And tomorrow we'll be I'm part of the clinicians for Planetary Health. Tomorrow we'll be talking exactly about that, sharing a lot of information on how can we implement to bring this planetary health dimension into the clinical practice. So check it out after. So now we are open for questions or discussions about this important movement. I do think the medical world is a very crucial, as it is the food system, like clinicians are also a hub to foster this movement. It's a very special place to start investing. So if you would like to, yes, please. Yes. So what's your name, please? So Barbara from London, she's working on that right now in a degree in UK, and she's saying that the problem is this silos, is this integration between fields. So and planetary health now is focused on the health field, right? So we need to do this transdisciplinary, this crossing. Make people understand that first, that is a matter, I mean, everything is interconnected and interdependent, and we can only move here if we move there. And to make this, to fix this gap of moving this forward. I'm not sure if I missed
Yeah.
anything.
Thank you, Barbara, for this nice question. So actually, I also presented on this thing that there should be a universal module for all all professionals, not only the health only. But the basic thing is the planetary health. It is the discipline that deals with the anthropogenic effect of the mankind on their surrounding ecosystem, and that's why, and its impact on the public health. So the basic thing is public health is in the center. So what impacts what we do to the nature and how it impacts on our health system or on our health, that is the focus. But in the process of this anthropogenic system, there are almost every discipline is included. So the outcome is public health, there is no doubt. So we have to be clear about this, that the focus is public health, that is center. But what is the role of the impacting the nature for the engineers, for the doctors, for the pharmacist, for the geologist? So everyone has a role, both good and bad. So based on his or her involvement in the movement and his intention or his education, his motivation, he can do it better or he can make it worse. That is the thing. So in geology, in mining, so mining sometimes it does lots of detrimental effect on the nature. Engineers, they can do it more conservation way, like nature conservation way. So maybe many people are not aware about this, that they are doing harm indirectly to their own health or the whole mankind. And that's why I agree with you that we should definitely develop a universal module for all disciplines who want to know about planetary health. That means it is not who want, actually everyone should want, and everyone has to do it if we want to survive. So that's why it's important. But that is a good thing, and because Jeremy is here, so we can argue that Jeremy can convey this message, and we are part of the Planetary Health Alliance. We should work on the development of a universal module. That I am an advocate for that, and I agree with you. Thank you. Yeah, that's true. So Seema, she is also one of our campus ambassadors. She mentioned about the impact of influence of medical doctors, health professionals, and this dissemination of planetary health to the public. So this is very important because as planetary health is not only a scientific discipline, it is a social movement as well. So the role of medical professionals or healthcare professionals, they are not actually just only the treat patients. That is the important thing, that our responsibilities are beyond the clinical duties. So we have to disseminate this planetary health to our patients, to our general public, to our clients, everyone, and then they will realize. And here there is a huge gap, that the healthcare professionals, they are not so much oriented to work beyond their clinical responsibility, and that is an important findings and important work to do in future.
Yeah.
Salia wants to speak.
Okay.
Oh. Yeah, just complementing this very fast. This is exactly what I will be talking tomorrow. Is about lifestyle medicine. I will bring this framework. It's because the lifestyle medicine is already bringing this dimension. You know, we are not just clinicians. We change our role. We are not like directors. We are kind of being together, giving the responsibility to people. So it's coming slowly. So Salia, would you like to say something, please?
Yes, please, yes. Thanks you guys for all the wonderful answers and the questions that are coming. And I think I would just like to compliment what you've said, Vanessa, and that of what Asad have said. The issue of planetary health, like Barbara, who would give that question, is a very brilliant one. And that is the reason why we have actually embarked on this education as the way out. That's why we've said to grow this movement, actually the education is the very key. A professional medical doctor must know that in addition to a clinical service, he needs to inform people on the environmental factors that are where planetary health is that leads to his health problems. The nutritionist, like you said, should know exactly why you eat and you get sick. So a geologist, so the engineer must be aware that the work I do to develop infrastructure is also a factor for health for the public. And like Assad said, public health is the end goal. And so whatever we do, in whichever profession we find ourselves, even as a lecturer, even the materials we use, we should be able to know that is this material healthy? What is the end product? What is the life cycle of this material? Are we using chalk? Is it cancer? Does it give us cancers or what? So we need to be aware of our professional life and as to how this impacts health. And that health is the planetary health that we are talking about. And like Barbara said, that's why we have proposed in this presentation that there should be some form of regional center or incubation center where the knowledge of planetary health will be nurtured and grow as in any field as possible. Thank you. Let me stop there for further questions. Thank you so much.
Thank you, Salia. It's a very nice way to put it this way. It's just, it's because it's a matter of mindset, of paradigm. We need to start individually. That's why the clinicians are very interested because they are dealing with individuals and we need to start there. But is another way of seeing, looking for life is to make this understanding of this system, this integrated, interconnected system, and every little profession is related to that. So very nice way of putting it. So yes, you have another question, or we are on time? Okay, so. Yeah, so I think we could close that, and we need to keep working on that in our connections online to be discussing about this. But I think the key points here is just like in the micro scale to spread the word, educating in each at home, in the community, in your institution, in your profession, everywhere. And yes.
Yeah. And thank you all for coming and joining this event. So we understand. Yeah. Oh, okay.
Oh, yeah.
Yeah. So
I would like to make one last comment, please, if I can be.
Yeah, sure.
I would just like to say to send this open invitation to Barbara. If she's a planetary health campus ambassador to be part of us, we want people who can come on board. If she's not, we can also find a way. Please collaborate with Vanessa, Assad, Sima. They are there. We can form a group and continue this after today's program. So we are open and we would like to see somebody already in education doing short stay.
Yeah.
So you are welcome to our group, whether you're an ambassador or not. Thank you so much, and a pleasure to be part of this.
Great.
Yeah, thank you all. Yeah.
Thank you.